Hello, I'm Dr. Martin Quirk from the Centre for Environment, Dementia and Ageing Research at the University of Stirling in the UK. I am delighted to speak to you today about a pilot study in virtual reality supported co-design housing involving older people. In the presentation, I will focus mostly on the co-design method and some of the challenges we encountered, then discuss how the findings of this work could be useful for improving both research and design practice. As regards to the findings of the co-design process itself and the questions of what might age-friendly housing look like, unfortunately I won't have time to go into these in much depth today, though I will touch very briefly on some highlights. This study, which was undertaken by Professor Judith Phillips, Leslie Palmer and myself, was funded by the UKRI Engineering and Physical Sciences Research Council, an undertaking as a collaboration between Cherish DE at the University of Swansea and the DSDC at the University of Stirling. Older people, including people with dementia, need and want to age in the right place. This has been demonstrated as an effective preventative approach to hospitalization and long-term residential care. Good quality, age-friendly housing is pivotal, therefore, to the delivery of high-quality social care and is fundamental to achieving the core objectives of integrated social care policy. Despite all of this, UK national house builders are not yet engaging in housing provision for an ageing population. The use of virtual reality is dominated by younger people and recreational applications. However, the capability of VR to enable full-scale immersive experiences of architectural design proposals provides an opportunity to engage ordinary people in the architectural design process. There is surprisingly little published research on the use of VR to support co-design, and none, unless we missed it, exploring the potential of VR to involve underrepresented groups such as older people, those with physical, sensory or cognitive impairments, in design that affects them. This pointed us to a clear gap in the research and a potentially game-changing opportunity to improve architectural design practice and outcomes, especially in housing. The primary objective of the study, therefore, was to test whether and how effective virtual reality might be as a means of supporting the meaningful involvement of older people in the architectural design process. We set the goals of the project to test this as follows: to identify age and dementia-inclusive housing design features that are likely to improve independence, quality of life amongst older people and their carers. We plan to do this in two ways. One, to identify potential improvements to the typical design used by a nationwide UK-based house builder, and two, to develop a brand new, sustainable, age-friendly and future-proof housing type. The study method that was originally approved by the funder planned to bring participants together for face-to-face group workshops. We thought this was fairly innovative as co-design research goes. However, the arrival of social restrictions related to the COVID-19 pandemic required a complete rethink and redesign of the project to a remote and online mode of research. Participants for the project needed to be older people. However, due to the redesigned COVID-proof methodology, they now also needed to have an internet connection and access to a device capable of hosting video calls, so a smartphone, a tablet, or a computer. The research activities were to be undertaken by the participants in their own homes, and workshop interactions with the researchers were planned to occur remotely using digital technology, Microsoft Teams calls mainly. Using VR carries a small degree of risk of injury. Some people may become confused, frightened or disorientated by the experience. They might not be comfortable wearing the equipment. As the person experiences the VR environment, they can also move around their physical environment, and some risk arises of them colliding with or tripping over objects in that space. So for all of these reasons, we required that participants using the VR headsets directly to have someone at home with them during the workshop. Each participant was sent their own VR headset for the duration of their individual workshops. Before participants had their first workshop, we spent time over a video call carefully guiding the participants on the use and control of the headsets and hand controllers, checking their comfort and confidence as we went. In the end, we had 11 participants living across northern England and the central belt of Scotland. 3 of these participants were unable to use the headsets directly themselves, so instead they experienced the VR models by live video feed cast directly from one of the researchers' headsets to a Teams call, with the participant then encouraged to instruct the researcher where to go and what to look at in the model. At the beginning of the workshops, we conducted semi-structured interviews with the participants focusing on housing preferences, any experiences of age-related impairments. We also inquired about each participant's experience of receiving or providing care within the home environment, as well as asking them about what they would ask for if given the chance to design a house for their future selves. The remainder of the workshop involved the co-design VR experiences in which the participants reviewed 2 house designs in virtual reality, each with a slightly different purpose. One of these, a standard UK house builder's design, we included this as a way of testing the extent and ease of adapting this type of house to suit the preferences and needs of participants. For the other, a new prototype house design, we started with a single level 2-bed house type. Here we gave the participants much more freedom in the potential design changes they could make. They could move walls, windows, change the size of rooms, or even the overall size of the house. Over 2 rounds of workshop, the participants were asked to critique each design based on their needs. Comments received from all participants across each round of design were collated and then used to inform changes to the design. The next 2 slides contain views from inside one of the 2 houses, at the start of the first round of design, and then after the second. If we had much longer today, I would talk you through these changes, the feedback offered, and the evolution of each design. There was some good consensus in the design advice offered by our participants for different areas of the house. Again, limited time means I will just pick out some examples from the following slides. Concerns around physical ergonomics featured throughout, but especially in bathroom and kitchen spaces. The big surprise here was that almost all participants requested a mid-height oven in the kitchen. Where there was a difference in preferred lifestyle of the participants, there were hints that some spaces need to be designed for flexible use. All participants wanted to have at least one generously sized spare bedroom. In reality, they wanted the space to become a hobby room, a home office, or a quiet lounge, all the while knowing it could be converted back to a bedroom for a family member or a live-in carer as needed in future. In terms of location, the participants neither wanted to be in a city nor in a rural location. They wanted to be close to amenities, yet within easy access of outdoor space. Therefore, the ideal was a bungalow on the edge of a small town with an easy-to-maintain garden. You can use the link to a web-based VR viewer here to try out one of the resulting house designs on your own phone or computer. The footage on the screen at the moment is recorded from this web viewer. To conclude, the approach and technologies used here improved two-way communication and resulted in better design outcomes. The hyper-realism of VR allowed the participants to gain a deep and detailed understanding of the design proposals that in turn allowed them to discuss design features in relation to their needs and preferences. The iterative co-design process, where participants could see the design evolve in response to their feedback, instilled an increasing confidence and sense of empowerment due to the value placed on their expertise by experience as genuine partners in the co-design process. The remote online working methodology, although it came about as a response to COVID-19 lockdowns, could also help overcome other barriers to face-to-face workshops. It also offers opportunities for research as a means for architectural practice towards including more diverse and more dispersed range of people in co-design. This form of co-design workshop process could provide opportunities for knowledge exchange, where collaborators may then go on to apply what they've learned to their wider work. Limitations. Despite all the positives here, it is probably important that we mention some of the challenges or limitations to the methods I have discussed. Running a co-design process in this way required more resource. More staff time was required to plan, set up, and run the online workshops. The VR headsets come at a monetary cost, but these could be a good investment if retained and used in future projects. As for most kinds of research that relies on the web for communication with participants, this may mean that some potential participants were excluded, whether through lack of internet connectivity, access to related devices such as computers and smartphones, or those without the skills or confidence to use the technology. As we found, inevitably, unexpected technical barriers arise when working remotely, so a flexible, robust approach is important to manage these and to ensure the participants' overall experience remains a positive one. What's next? We are due to present some of the findings of this pilot study at dissemination events involving housing, design and construction professionals. We are also working on publishing our findings in academic and in industry journals, in the hope that this influences wider research and architectural practice. Excitingly, this method is also being adopted for use in a larger project led by Professor Alison Bowes at Stirling. The project we call DESHCA, which stands for Designing Homes for Healthy Cognitive Aging, will design housing with input from at least 100 people experiencing cognitive change. And in an especially unusual component of a research project, we also plan to construct physical demonstrators of the resulting house designs. Hopefully myself or one of my project colleagues will have an opportunity to tell you more about the DESHCA project at another time. Very finally, if you have any questions or feedback, and we run out of time for them during the live session, or indeed if you are watching the recording afterwards, then please feel free to contact me, Dr. Martin Quirk, using the details on screen. Again, we will make the PDFs of the slides available for the audience after the presentation. Thanks you once again for listening and watching.